Is joining us. You're listening to the More You Know Show. I'm your host, Tina Douglas. Today I have three lovely ladies in my studio. They all are subject matter experts in the topics that we are discussing. I have with me Dee Hughes, Gabby DeWitt, and Amy Wright. And Amy, we haven't left her out, but we have just been talking with Gabby and Dee for the first part. So now we're going to switch gears and let Amy do some talking. Amy, again, Amy is the manager of the Prenatal and Women's Health Clinic at Wheaton Franciscan Healthcare, Covenant Medical Center. So Amy, what's the Covenant, tell us about the clinic, where it's located,
Sure.
how long it's been there, what are some of the services?
Sure. Yeah, we have a little gold mine up on 4th floor at Covenant, right above labor and delivery. Labor and delivery is on 3rd floor, which many of the listeners probably are familiar with because there's lots of babies born there every year. So we're right up above them on 4th floor. We're a faith-based nonprofit, just like the rest of Covenant. And the unique thing about the clinic is that we're run strictly by women. We have midwives that see our patients. I know, a big cheer in the audience here. The midwives, we have 3 midwives that see our patients. Our staff RNs are all women. We have dietitians, social workers, myself, the secretaries. It's totally a women-ran clinic, I should say, that sees everybody. Services. I mean, when you think prenatal, you think babies, which is a highlight of our jobs when they come back with their babies at their 6-week check. But we do so much more than that. I work with Gabby when we have someone that comes in for a well woman exam and they need a mammogram. I give Gabby a call and she helps them set up for the mammogram. So we do the yearly exams, and like Gabby had a very good point that there is no reason why every woman in Black Hawk County should not have an annual yearly exam of their pelvic region. So we're there to provide that for them as well.
And keeping up, Gabby, I got to give you some kudos. I was just in a meeting not too long ago, or last week, and your name came up in the discussion about how we were talking about reaching out to the community, and we were talking about how your program is successful, and they said it's because Gabby DeWitt came to the people who were in need.
Oh,
so that speaks so much of what you do, Gabby. How you have a passion, for the care for yourself.
Well, I do, and I think that we are positioned well in the community, the Black Hawk County Health Department, because we weren't a alliance to either hospital.
Mm-hmm.
So we can go and be friends with everybody, and kind of bring it together. And if a person wants to go to the doctor that they've been going to their whole life, usually we can make that happen. You don't have to go to a certain office just to get screening. And so we want to make things as comfortable for women as it can be, and if they only want to see women physicians, then we want to make that happen, and we know of the clinics that offer that. So we try to meet women where they're at, so it's nice to hear that.
Yes. And it's just good to see the collaboration. Not too long ago, there was no services. Allen stays at Allen, Covenant's Covenant, Black Hawk County, Black Hawk County. And in order to meet the needs of the community, you need to have the collaborative services. So I'm just so glad that that's what we're hearing. That's what we're getting.
Well,
and it's user friendly.
It is.
You make that call. It's
Yeah.
not I need to know your water bill. Bring some pay stubs.
Yeah, actually,
all that.
I was going to say that there is no proof of income. We go based on a person's word, because really, there's not a whole lot of women who are that excited about getting their mammogram in the first place. So it's the idea that they would fake their income just
Right.
to go get their breast squeezed. we
That's
just
right.
don't feel like it's necessary. So we don't do any type of income guidelines. But also, I think this program has been in our community for 15 years. I've been working at it for 13, and it was always open to the community, but it was housed in a location that I think the community felt like maybe I have to go to that particular office in order to access it. So it's always been open to the community, but positioning it at the Black Hawk County Health Department has helped because we have no ties either way, in the community. And also having a staff person, that is specifically focused on that helps, because I have the time then to either talk to providers and make sure that they're referring to us, talk to women and make sure they're getting in, that sort of thing. I can go to a woman's home if she's been newly diagnosed and help her go through her mail. I mean, we have that capability because I have that staff time to do it.
That's awesome. Don't stop doing that.
No, I won't.
What you do could be the role model, set the standard for what needs to come, further in the future as far as getting the services out, letting people know that it's user-friendly, letting people know what the resources are, because sometimes you know, I just don't understand how many years ago, you didn't have time to talk to the doctor didn't have time to talk to you. Now we have all this technology up front, in front of our faces, and we'll let the doctor walk away and not even ask. Oh, I didn't ask. Why didn't you ask? Well, before you wanted to know everything, the doctor didn't have time to share it with you, you had to make an appointment. You had to, or camp out, wait for the doctor to come, you know, in a hospital setting. You know, the doctor comes early in the morning, so I'm gonna sit right here, wait till he comes. Now, you can ask the doctor anything that you wanna ask, but now we're more reserved, and we don't wanna do that.
I always tell women two things. First of all, you know, you have to be your own advocate. If you can't be your own advocate, take somebody with you. And I tell them to make a list, because I can be thinking a month up into my annual exam, I can be thinking, oh, I'm gonna ask this, I'm gonna ask this, I'm gonna ask this. And then I get there, I don't have my clothes on, my head's, you know, not where it's supposed to be,
Right.
and you know, I forget, and then I leave, and I'm like, oh, darn. So I tell them to make a list, and and I do that for myself. I make a list, and so if there's things that I've been concerned about in the year, then if I have my list, I won't forget to ask. And I make sure that the doctor stays until I get those asked. But also, it does take a matter of a woman knowing that she has the right to ask those questions, and she is important. And so, you know, to demand that attention from your physician, that you know, I want your time, I'm paying for your time.
Yes.
And, you know, I only get to see you once a year, you know, for my well woman check, these are the questions I want answered.
But that's a good start. I always say, whenever I get the opportunity, take someone with you, no matter what.
Mhm.
You just be a regular checkup, it can be follow-up. Make sure you just
Extra
have that
set of ears.
extra set of
Yeah.
ears.
Yeah.
Because if I hear anything negative, that's it. I'm shutting down. I didn't hear the good stuff that went around, the negative. All I heard was what you said, and that's it. I'm shut down. Somebody might say, well, he did say that, but you know, there's a way to do this. You won't get this if you exercise or do this or that. I didn't hear that. I heard him say, you know, I'd shut down. So I need that extra ear, you know, keep me straight. Otherwise, if I go by myself, it's probably gonna be a disaster. But back to you, Amy.
Yeah.
Going back to the clinic, tell me about the annual exams for non-expecting mothers, and who can come to those, and what services are provided for the
Sure.
non-expecting mothers?
Sure, well, Covenant actually was the recipient of a grant through United Way about 2 years ago to make sure that anyone that doesn't have insurance or does not have enough insurance can come and have their annual exam. Unfortunately, that's the one appointment that we usually don't put on our calendar, just like the mammograms. You know, we're so good
Yes.
at taking care of everybody else as women, but taking care of ourselves doesn't hit the top of the list most times. So, you know, those appointments are the ones we need to get. And so the United Way graciously gave us a grant to be able to give those annual yearly exams to women free of charge, regardless of their insurance state. Same thing, we don't ask questions about insurance, we take you for your word. It started out as being, the goal was to hit like the college age kids, 18 to 21-year-olds, but now we've realized there's a huge, bigger need in the community to hit above that. So now we accept all ages to be able to come in and get that yearly exam, whether you're in college or you're in menopause. You need to get that annual exam done. So that's one of the great things about the midwives. They're there and they can do those things. Now, if there were to be an abnormal result from your pap smear, then we would walk you through where to go from there. You know, give you the referrals that are needed to do, or for mammograms, partner with people that can help you get the mammos.
Are they, through the Women's Health Clinic, are they able to get the breast exam? I mean, the mammography services too, like the same day?
No. Well, a lot of times then we'll go ahead and I'll call Gabby. I know I called Gabby one day and she said, well, just have the person call me, and she arranged it from there. We don't do them right there in the clinic, but a lot of times they can be done very quickly afterwards, after their appointment.
Because I go to the women's clinic,
Mhm.
but this is not the same.
No, this is a little different.
Yes,
Yep.
I go to Dr. Wino and those guys.
Right. We're just down the hall from them.
Right. Because when July is my month. And I don't know why I say that, because you know, July is the month, but your insurance keeps getting, your insurance, like if I had it in August, it's gonna be, you know, they gotta wait till the last day, and then it gets to be September, just like when you renew your CPR, you know, you get scared, you do it that month, and it's not the same the next year. So it's not July, I just still do it in July, but for the rest of the stuff, but my annual pap smear and things like that just keeps getting pushed back the month before, but all those services are right there. All those comprehensive services are right there. I just go from one to the other, where before you had to make an appointment for both, and I love that.
Mhm.
I love that.
Yeah.
That's my guest next week. That's what Mary Kramer's gonna be next week for the breast cancer navigator services that they have there, but,
Okay.
so the difference between the Women's Health Clinic, where you're at, is that you have collaborative services, and that's when Gabby comes into play.
Correct.
With what she does.
Correct.
Awesome.
Yep, we're good partners.
And vice versa too, because I can't, while I can accept a woman age, under age 40 if she has a breast problem, I can't accept a woman under age 40 if she's just wanting a pap. And so then that's when I can refer back to the prenatal clinic and say, well, no, but I know of this program that you can access. So it really makes good sense if we know what else is available in our community.
Yes. It's all about resources. There are plenty of resources out there that the community may not know of or not know how to access those resources.
Exactly.
Right. And we have a van service too, so if someone needed a ride, we could help arrange a van to come and pick them up, bring them to their appointment, and take them back too. So it's a fabulous way to get even more people in the doors, because, I mean, this is an appointment you can't afford to.
Is it the van driver a female?
No, he's a male, but he's a nice guy.
He's prompt and he gets them where they need to be. so
That's right, and if they're not there, he's calling us saying, where are they at? So
Yeah.
he's very on top of it, yes.
So tell me, walk me through the steps how you access the services, because I want to make sure that that it's user friendly.
Oh, it's very user-friendly. You just call the clinic at 272-8200. Just tell them you need your yearly exam, and we take it from there. There's nothing else they need to do.
And these people are underinsured or don't have any insurance.
Correct. Yep, or you can have insurance too, but the United Way grant strictly covers those that are under or no insurance. Yep. So it's trying to get as many in the door, especially if you think like college-age kids, that's the last thing on their mind. You know, my son can't remember to shave half the time, so I don't expect a female to remember to get her yearly when she's in college. So, you know, college students, a lot of times they don't have insurance, or they're under mom and dad's insurance that doesn't cover it, so they're more than welcome to give us a call as well. We would love to see them.
So in the past 2 years, what have you seen from the grant? Are you getting the numbers that you need?
We're not. Women are hiding. We're not seeing the numbers that we expected. And so that's why we're going out and trying to, you know, just really, like Gabby said, and I said earlier, that there's no reason not to be having this. And, you know, we've got this wealth of knowledge in the midwives, the knowledge in the staff, the process for referrals, that we're here, we're waiting for people. We just need, I think, to get the awareness that we're out there. And unfortunately, it is the appointment nobody wants to talk about or think about too, so we'll just keep plugging along.
Especially, I think it's hard to reach the college kids, not so much the ones in their 20s, but the 18 to 20 group.
Absolutely.
Like it's hard.
Absolutely, and you know, at that point, you know, it's an embarrassing appointment I have to go to. Oh, I have to take my clothes off. Oh, I have to have this done, you know, and that's where the midwives come in too. They're so nurturing. You know, they see women throughout their entire lifespan, and they're just, you know, pull up a chair, sit down next to you and talk, and just very, I don't know, just like your best friend almost. And so they make it a very welcoming environment and a good experience, so that they can come back and become proponents for their own health, and be little cheerleaders for their own health.
Yes. What's the clinic have to offer as far as pregnancy appointments and things like that, traditional pregnancy appointments?
Well, we offer free pregnancy testing, and that does not need an appointment. That can be drop-in. Just come in and say you're there for pregnancy test, and we'll get it done. And then we start, as soon as you find out you're pregnant, give us a call, and we start the intake process as far as come in, and then that's where we evaluate insurance. You know, are you in Title 19? Do you need help finding insurance? Do you have insurance? And then we start planning out the appointments from there. The midwives see you clear through your pregnancy. Unless there's a complication, then we actually, the overseeing doctors or the doctors in the office that you referred to, the partners in OB-GYN, associates, excuse me, and so then they would help us kind of share care, and then, but it'd be the midwives that would deliver if we feel that it was still within the scope of the midwife practice. They deliver your baby, they see you 6 weeks postpartum, and then yearly exams, we come back in to play again as well.
So when you walk in for this free pregnancy exam, walk me through that, because how is that? How does that happen? Okay, I walk in.
You just walk in, yeah, just tell the secretary I'm here for pregnancy tests. They'll take down a little bit of information from you as far as your name, things like that, and then the nurse will take you back into the room and walk you through the steps of taking it, peeing on the stick pretty much, and then help you read the results, and then if it's negative, you know, talk about.
And there's also right in there, like the
it's
EPT
right
test?
there, yes, it's right there, yes. And you're one-on-one with the nurse, and if it's negative and you're hoping to be positive, you know, we can talk about it. If I haven't had a period in a couple of months, we can set you up with an appointment with the midwife to do an annual exam, find out out, is there something else going wrong? And if it's positive, then we go ahead and set up a plan of care for you as far as, okay, this is when you need to come back, this is when your due date would be, and that sort of thing. So it's a one-stop shop.
User-friendly.
User-friendly, it is, it's a little gold mine.
Yes, that's awesome. It's so important to know that when you access these resources, it has to be friendly. Because that'll turn people away if it's not. And all it takes is one complaint. You're talking about word of mouth. One complaint. Don't go to that clinic. You know, they treat you like crap and blah, blah, blah. They're in your business and this, that, and the other.
Right.
So it's good to know that that's a user-friendly place that you can go to and get the services that you need.
And we're very welcoming, you know, when support people come, sometimes people want to bring their moms, their sisters.
Yes.
They have little children. We're very welcoming of all of that. If it's going to be where you have to have an exam and you brought your child with you, the nurses are always very excited to grab one of the children and go play with them so that the midwife can have the time with the mom to be, and that way the child's not in the exam room with them. So they're awesome staff that will help accommodate whatever we can.
Okay, let's talk about the Centering Pregnancy Group.
Yes, this is very exciting. This is something we just started. Centering Pregnancy is a group approach to pregnancy examinations or appointments. Instead of coming in and being by yourself and having only 5 or 10 minutes to 15 minutes with the midwife and forgetting things that you might have wanted to ask, this is a group approach. So you come once a month and come in and the midwife would examine you for the first few minutes and with everybody in the group have their own little time. And then they come together as a group and they do education. There's time where they can just talk to each other and say, well, I'm experiencing heartburn. What are you doing for that? And someone else will say, well, hey, this is what I did and it worked great.
Yeah.
And so it's a time where they can sound off on each other in a safe environment. It's also a place where, you know, I might be too shy to ask a question, but I know she'll ask it, so I'm just gonna, you know, let her roll with it and let her ask, and that way that person's question got answered, but she didn't feel intimidated by it. We have snack, and then follow up as needed. And then we'd also schedule like the ultrasounds and things like that. But basically, it's a great place to form friendships. It's a great place to educate each other and to receive education as well. And then once they've all had their babies, we bring them back together again and have a graduation party. So friendships are established not only between the moms, but then hopefully the kids as they continue to grow as well. So our first group is rolling. We're doing good, and it's one of those things that when they come in for like the interview process, we would determine if they're a good candidate for it. Obviously, if they have a complication like high blood pressure and need to be more closely monitored, they wouldn't be a necessarily good candidate for the group, but we would help determine that when they come in for their interview.
So is everybody eligible for the group, or just those ones who want to be involved are in it, or how does that
It's
come?
totally voluntary, yes. If we always present it at the interview session, which is like the first time they come in and say, this is what we have, we think you'd be a good candidate, and then see if they're interested, because it's only offered certain dates and times. Our current group meets like on Wednesdays from 9 to 11. So it all depends on work schedules, daycare issues, things like that, if it would work in your schedule and if you're interested. And some people are more interested in just the individual sessions, and that's totally understandable as well. But it's very exciting because I know, I was 18 when I had my first, and to be able to know that if I would have had somebody with me that was due about the same time as I am, that I could say, how did you do this? To bounce off of, it would have been very reassuring as a new parent, or even second or third babies. We have moms that this is their second baby, and they're kind of taking those that it's their first baby and wrapping their arms around them and guiding them as well.
That's
So
good.
it is good. It's a community effort.
So if you're in this group that's a volunteer group, and if you choose not to be in the group, you're still not going to be missing any of the services that are provided.
Correct. You'll still get everything. It'll just be a one-on-one session instead of the group session. Yes.
Do you have a number that you can give?
Same thing, 272-8200, or you can go to www.wheatoniowa.org. But the 272-8200 will get the clinic, and they can give you lots of information.
So from the moment they enter their phone, it's user-friendly all the way?
Absolutely.
All right,
And
that's
if
what
not,
we need
they
to know.
can
That's what we gotta
transfer it
push,
to me.
especially in the community, like,
No, and my office door is always open, my phone's always open, so they can always, I'm glad to talk to them if they just have a question about the clinic as well, so.
Good.
It's very exciting. It's an exciting time for the clinic. We're growing and want to get bigger.
That's good to know. So, getting back to the grant, because your clinic is a grant, does the grant expire, is it ongoing, or?
We want to see as many patrons as we can by June, but that's not to say that we won't try to find other funding at that time to be able to keep doing this service, because it's a service that is very much needed. When I look at the number of people who have scheduled exams and we're not able to come to their exams, it's startling, the numbers of people that scheduled that did not come for one reason or another. So I know they're there, I know they want to come, but something got in the way that they're not coming. So we need to be able to figure out, is it transportation, is it just
Right.
the reminders, and that sort of thing. So there's a definite need. I know Gabby and Dee can relate to that as well, that there's a definite need for this in the community.
And that's in everything, it's just,
That's
don't think it's just your
everything.
clinic, it's just, you know, the services are
Absolutely.
available, the screenings are free, all this, and then you have such a low, you know, people don't show up and go, what's missing, what,
Right.
because
what's
this is
that
free.
missing link? Right.
Mhm.
Why would people wanna come to this?
Right, yes.
So, yeah,
Yeah, so it's time to start putting yourself first and start getting those appointments on the calendar every year, every month, whatever you need to be, because we can't take care of others as women if we're not taking care of ourselves. It's the bottom line.
yes, that's true. You might need to do a PSA, come on down to the.
Hey, sign me up.
Or us bias for women, except we got a male driver, he get you there on time. You gotta get those people in here.
He does good.
We got a few minutes before we close, and Dee, I know we haven't even touched on support groups that are in the area. We're talking about the Beyond Pink team, we know that's a support group. What information would you like to share with us?
Well, one thing I wanted to say about the Beyond Pink team, it's our local organization that helps women with breast cancer, provides services and all sorts of things. It's a very collaborative effort. From the start, we are celebrating our 25th anniversary this year, and from the first day, it was a combination of people from